Manaswani for that amazing introduction. Once again, my name is Phil, and I'm one of the heads of programs here at Nunchi Health. I'm also a patient care coordinator at Progeny Psychiatric Clinic, which is a behavioral healthcare organization based throughout Southern California, and I will be serving as the moderator for today's panel. So thank you all for joining us. We're so excited that you all are here. So as mentioned by Manaswani, we will be featuring 3 inspiring immigrant origin individuals who work in various fields of mental health. First, we have Chinmayi. She is the founder and CEO of Simply Neuroscience, a youth education nonprofit. And then next we have SJ. He is a clinical research coordinator at Harvard University's Stress and Development Lab, a youth psychology research center. Yes, exciting. And then finally, we have Wathma. She is a student clinician at Bakersfield Behavioral Health Hospital and a clinical psychology doctoral student at Alliant International University-Fresno. Okay. And then each of these panelists will be sharing their perspectives on intersectionality in mental health, specifically within immigrant origin communities, and their experiences in their respective fields of expertise. So with that being said, let's go ahead and jump right into this panel. Excited to have you all here today. Thank you for joining us. So how this is going to work is we are going to be starting with the questions that the programs team has prepared. Some will be open for any panelist to answer, and some will be directed towards a specific panelist. So I'll specify that once we get to those. But if y'all are ready, I'll go ahead and start with a question for any of the panelists to answer. And it is, what does intersectionality mean in the context of your work in activism, and has that changed over time?
I can get us started. Hello everyone. What an amazing group. My name is SJ, and yeah, very happy to be here. Yeah, I really love the focus of today being intersectionality because yeah, it's become a lot more popular in recent discourse, and I'm really grateful for it because I think it's an idea that can really that has been around since the 70s, but it can really enrich our discourse when we center it. And I mean, to me, in the context of my own work, I work as a researcher studying how adverse experiences impact brain and behavioral development to increase risk for mental health problems. And I take a public health approach from this, where I try and study this with a structural lens. And intersectionality plays in to that by really trying to see individuals as multidimensional with different identities that interact to shape their experience of the world. People may experience different stressors because of how different systems of oppression are interlocked. So for example, in the case of immigrant stressors, people may experience those stressors differently depending also on their race or their gender. So as an example, a Black immigrant within the US will face obstacles of the US immigration system, but in a way that interacts with all of the stressors present in racism within the US. And I think in research, it's really important to pay attention to those interactions because otherwise you miss a lot. And also, I work as a shift supervisor for a local crisis center, and I think we see that a lot happening too, where people have to navigate multiple systems at once. Yeah, and I'll leave it at that for now. Yeah, I'm curious what other panelists have to say.
I'd love to jump in, and thank you, SJ, for starting us off. Coming to you guys from a lovely morning here in California. Great to see you all. I really, really appreciate, SJ, what you mentioned about multidimensionality. I work a lot in the education space and teaching young folks about how cool brains are and how cool neuroscience is. And I think something that I've realized over the past 5 years of working in this space is it's one thing to have a straightforward curriculum that says your brain has X, Y, and Z parts. Cool. Now go study biology, go become a neuroscientist, go become, a doctor or something and do something with that knowledge. But I think the way in which we interact with what we learn in the classroom and beyond has a lot of significance in terms of relating to our identities as well. Because, for instance, when I study neuroscience, I come in as someone who has seen, let's say, the impact of a lot of these different neurological conditions in real lived experiences among family members and friends. I come to the table as someone who acknowledges that as a native English speaker, the knowledge and resources are not as accessible to my peers who may speak English as a second language, come from many communities in the global South, for instance, have moved to this country when they were really young, struggled with navigating the education system. And so I think a lot of what when we speak into in the mental health education space and how do we really apply an understanding of neuroscience to treat ourselves and one another in our communities with empathy through understanding our brains. I think a lot of that there needs to be more important discussions about how do these identities intersect with what we're learning in the classroom and beyond. And how can we try to dismantle those barriers? Because education is a very large part of what ties into awareness, into stemming advocacy, to stemming research. So I think it also trickles to many different areas from there.
I can go ahead next. Thank you, Chinmayi. Hopefully I'm pronouncing your name right. And SJ. So piggybacking off of both of them, I agree that when SJ said that intersectionality is multifaceted and multidimensional, because I work in a field, I work in an inpatient hospital. I used to work with adolescents and kiddos, but right now I work with prisoners who are waiting to stand competency. And it took me a long time to realize that intersectionality plays a role in how they are shaped, how the decisions they make, and how their worldviews are different. For example, like if I meet another South Asian woman, her experiences in life are totally different from my experiences. And what I go through living in the US as an immigrant is totally different from somebody who was born here. Her mental health challenges are very different from my mental health challenges. Recognizing that, acknowledging that, validating that is, I believe, is the first step going forward in helping individuals, immigrants, deal with their mental health issues.
Thank you all for your amazing answers. Yes, I'm so excited for this panel because I'm sure y'all are going to have a lot of insightful information to share. So we can go ahead and move on to our first directed question. And this one is for SJ. And it is, how does the immigrant background of individuals impact their access to mental health care services?
Yeah, thank you. It's a great question, and I feel like we could talk about it for a while. But I will give it a go, and feel free to chime in. So I think that there's structural and interpersonal ways that the immigrant background of individuals impacts access to mental health services. On the structural side, it has to do a lot with the policies across the United States. The United States, it quite varies in the level of inclusion and exclusion of immigrants by state. So, for example, some states have public funds available to people who are not citizens to access care, and some states actively target undocumented immigrants. And that makes like accessing care so much harder, and also just increases stress and potential traumas and increases the need for mental health services. So it's quite an unfortunate loop. Also, a structural question is like, what is the presence of ICE and other immigration enforcement in the community? and how much control do individual providers have over limiting the presence of those people. And there's also, interpersonal ways that immigrant status manifests in seeking a mental health care. So, for example, are there people at a clinic, for example, that speak your language, your first language? Have you heard good or bad reviews from this clinic, from people of your same background? And I kind of touched on this a little bit earlier, but I would also add that it's super important to consider that these systems that are related to immigrant status don't just affect access to mental health services, but they also affect the incidence and prevalence of mental health problems because of the stress that many policies place on immigrant groups. And on the positive side, how healing it can be to live in a state or climate that is supportive and inclusive of immigrants. And I think a lot about prevention from a public health lens. So just wanted to chime in and say that, like, the factors that make accessing mental health care easier also improve mental health generally. So just very for upstream approaches as well. But I'll leave it at that.
Thank you, SJ, for answering that. Okay, and then we can go ahead and move on to our next one. So this question is going to be for Wathma, and it is, how can mental health services be adapted to be more inclusive and effective for racially and ethnically diverse populations?
So I'm still a student clinician. And when I first started working as a student clinician, I noticed that most of the therapists that I come across are taught in, I guess, through the years, it's developed. But from my lens, I've seen that it's a more westernized approach. Most of the therapeutic approaches that they're teaching are more like narrowed down to westernized approaches. Some of the therapeutic approaches do not adhere to South Asian people. They don't adhere to Southeast Asians, Asian Pacifics, and most of them are not culturally appropriate. And something that we learned in school and in our college is that ensuring that mental health professionals are provided the competency trainings, so that they are always in line or always up to date with the changing world, with the changing ways that therapy can be changed, and always up to date with the different things that are happening around the world. Also providing and also recruiting mental health professionals from diverse backgrounds, not just white people, not just white therapists, recruiting therapists who are Asian, South Asian, therapists who are from diverse cultural backgrounds, who have different worldviews, so that once you see clients, the clients have a sense of belonging, that, oh, this therapist is the same color as me. I feel more confident. I feel more safe to talk to this therapist. Maybe this therapist will actually understand what I'm going through. Clients have different worldviews. We can't always see one worldview like the westernized worldview. We have to adapt with the changing world. And also, I believe that engaging in community organizations, community engagement, like Nunchi Health, having community engagements, having mental health professionals volunteer or engage with the community and seeing what their needs are, instead of assuming what they need, asking organizations or individuals what we need to be providing them. I'll stop it at there for now.
Yes, thank you so much for sharing that. I can definitely relate to a lot of what you said about how it feels like it's very geared toward like westernized techniques and like Western ideals. So it makes it a little hard to connect as a Southeast Asian person. But yes, thank you so much for sharing those insights. And then, okay, we can go ahead and move on to a question for Chinmayi. And it is, in what ways does the school environment affect the mental health of youth? And how can schools better support mental health care?
Thanks, Phil. This is quite the can of worms to open because there's a lot of different aspects to it. I think with most of us being students, trainees still, we spend a very large proportion of our day-to-day life in classes and in the school environment, whether high school, college, or beyond. And so I think the social or the peer environment and our interactions with educators have some of the largest influences on positive aspects, such as the resilience, or more negative impacts in terms of you can think more like, unfortunately, bullying, social exclusion, and feeling disconnected from the people that we are in shared learning spaces with. And I think there has been a national movement to try and increase more direct mental health support through school systems directly. And we know that, esteemed professionals like the Surgeon General, Dr. Murthy, are now hosting more and more conversations about loneliness and how among young folks, school is a really important setting to try and combat that issue. And I think there's obviously systemic problems that come in hand with that too, in terms of why is there such a gap in mental health services for youth in schools. One, school counselors and wellness counselors, there's such a shortage of those professionals that are available to students. Oftentimes, 15-minute appointments can't cover much, and they're trying to cover maybe a 1 to 400 or 500 student ratio. And also, they're very much underpaid. So there isn't really, I think, on a systemic level, that needs to change as well in terms of support for training more professionals to be able to equip that need. But I think aside from the professional services as well, in terms of addressing mental health care in the school environment, you can integrate a lot of aspects into the usual structure. So what do I mean by that? There is a field of neuroscience called educational neuroscience that tries to use what we as scientists and researchers have figured out about how the brain works and to try and incorporate that into the classroom. For instance, we know that cramming before an exam the night before is not good for your scores or grades probably, and two, it's very detrimental to your mental health, and it takes a while to recover from that because you're kind of getting caught up in this cycle. So educational neuroscience says we need to expose students to healthier study strategies, to taking care of their sleep hygiene, for instance, because how many of y'all really had a sit-down lecture about sleep and why kids need to sleep when you're in high school? Probably nothing. And so I think helping develop those small but really essential habits of, hey, instead of just cramming before the exam, we want you guys to learn more about spaced repetition learning. We want you guys to understand how to eat well, so it promotes your well-being because of the gut-brain connection, sleeping well. All of these aspects that extend beyond the classroom, but at the end of the day, help us as students show up to be our best performing selves in the classroom and get a good education and do well in the world. So I think that there's always this big questions thrown about like, there's this whole big crisis. How do we solve this? We need policy, we need this and that. But I think at the end of the day, if we can divert some funding at the local regional level into our public health school systems to implement these kind of small changes of having these kinds of more peer-friendly workshops and building that resilience through a form that's not sitting down for a lecture in the multi-purpose room with 400 other students on a Friday morning. I think those kinds of steps go so much farther than waiting for the trickle-down effect of addressing all these other systemic issues. So it's really a solution that needs to go hand in hand. And that's where a lot of community health workers can also play a role in bridging that gap. So I think I'll pause there. And I wish I had a little Uno reverse card because I'm gonna flip it back to Phil. Coming back to kind of a similar discussion theme as SJ in terms of Phil, how do you feel that your identity as being Southeast Asian youth and as an immigrant origin youth has really affected your positionality and your advocacy in mental health?
Oh, okay. Thank you so much for that Uno reverse card. Yeah, I can go ahead and answer this question. I think so. Yeah, basically, I am a child of two Filipino immigrants. Both my parents immigrated from the Philippines, and then I was born here in California. So it's definitely been very interesting, just because I feel like um, Filipino culture, a lot of Southeast Asian cultures, like mental health is not really, it doesn't exist basically to them. Like, oh, it's not a problem. Like, it's just you just have to suck it up and keep going kind of thing. Like I can even remember this one time at dinner when I was talking to one of our family friends, and she was saying how like our generation is always thinking too much about things, and like that's what causes our anxiety. But in their day, all they had to do was take it day by day. And I was like, oh, that's a very interesting take, but okay, thank you for sharing that. So I think like I definitely have a lot of firsthand experience with seeing the stigma, and like how like really navigating that has been very difficult, just because I like grew up in a home where that's kind of the mentality. But then I'm also obviously here in California, where mental health and like is a lot more talked about, especially like when I went to college at UCI. Like that's when I really was exposed to the importance of taking care of your mental health and the ways that you can do that. So I think that kind of has really inspired me, because I realized that this experience probably isn't just my own. Like I'm sure, and I'm seeing it right now, that there's so many people like me who are facing these same struggles with growing up in a family that's not really open to mental health, but also trying to, because of that, you have to kind of navigate stuff on your own, or like find your own ways to navigate these things, which I think with those experiences, I think it really has made me passionate about advocating for um, the mental health of specifically immigrant origin youth, and which is why I kind of landed here at Nunchi. I stumbled across it one day, and then after like reading more about it, joining the fellowship, and doing all of that, I realized like how passionate I am about it, and it's been honestly so amazing, because kind of like what you were talking about, Chinmayi, like the really safe, like peer-based community, like it can do a lot more than you would imagine. Because like when I was in the fellowship, it honestly impacted me in many ways I didn't expect it to. So yeah, honestly, very grateful for that. So that's kind of how I think my identity as a child of two Filipino immigrants has really affected my just kind of my experience in the mental health space, and my passion for advocating for other immigrant origin youth and their mental health. But yes, thank you for that question. Very fun. And then, okay, so now we can go back to a question. This can be answered by anyone, so feel free to answer. Um, it is, how could an intersectionality lens shift the way we understand and treat mental health in these communities, specifically immigrant origin?
I think Wathma touched on it really well in terms of, being a fellow South Asian woman. The two of us here ourselves probably have very different life experiences, and extend that to how many people are in this call. The majority of us may be immigrant origin youth, but every single one of us has a different journey. And so I think just coming to the table with that, moving beyond that one size fits all approach that Manaswini kind of introduced to us, is really lovely in a theoretical sense. And it's really tough to implement on a personal sense, because we all bring biases in our own lived experiences when we are supporting the people that we're conducting research with, our clients, our patients, our peers, and whatnot. So I think built into kind of a little bit of intersectionality is this idea of cultural relativism, where we do not judge other cultures. Each one has its own very valid stance and its very valid context and rich history. And so actually at one time at this neuroscience research conference, I was presenting this kind of a cultural relativistic look on Alzheimer's disease. And someone in the questions asked, why do we need to even, like, what comes out of learning about all these different cultural communities if at the end of the day you're saying that we can't translate this to others, you can't make those assumptions, and it's not a one size fits all approach? Like, it sounds contradictory. Why are you doing this then? And I think at the end of the day, the more that we know and the more that we put ourselves out there to learn about, take our lived experience, bring it to the table, bring someone else's to the table, not compare, but rather understand what similar challenges have we faced, what unique experiences have they had, which I can now help to understand my view. Personal reflection and peer reflection. So I think that the way that I understand intersectionality is very much that, in terms of how much can we learn and listen and use that to inform our work in finding more of those hidden questions in the gray areas that people haven't addressed before, and try to make a difference in there. Because a lot of the space in terms of mental health treatment and research has been dominated by voices unlike ours. Let's put it straightforward. A lot of us have not had those really senior leadership positions at the table, and our generation is really at the forefront of kind of this grassroots movement. So I think that acknowledging all of our experiences and to really tell someone who you're working with that I hear you. We may have not had that shared same experience, but I hear you. And I recognize that perhaps these XYZ experiences and XYZ conditions and symptoms that you're experiencing don't fit into that traditional gold standard that Western health has had to offer to you. So let's create a new paradigm together. And I think that's where a lot of that intersectionality introduces that flexibility into our work. And it forces us to live in those gray areas. Think about new research paradigms. How can we capture symptoms of depression in a culture where depression does not even translate to that language? How do you do that? And you need people who are, like us, willing to sit down and listen. And you also need people to help liaise on the other side too. So I'll pause there.
I'll go ahead. I'll piggyback off Chinmayi. I agree with so much of what you said. You actually talked about everything I wanted to say, especially the part about sitting and listening, which we tend to do a lot with our patients as a mental health professional, as a student clinician. Just recognizing my biases, recognizing my privilege, sitting down with my client, even if they are from the same background as me, and not assuming that just because I'm South Asian, you're South Asian. I don't know what you've been through. I don't know your lived experiences. Just because we have the same skin color does not mean that we've both been through the same thing. How you view the world, how your biases have shaped you is different from how my biases have shaped me. Just sitting in that room, creating that safe place, recognizing your intersectionality, and bringing all of that into therapy, giving space for you to speak, listen, validate, and talk about your experiences. I think that's what we need to do in mental health. Because, like you said, intersectionality plays a huge role. Your gender, your socioeconomic status, where you were born, the people you associate, your worldviews, your lived experiences, they all come together to build who you are. So I think it plays a huge role, especially in the mental health field. So, yeah.
Wow, thank you both. I feel like I have very little to add because y'all hit on a lot. Yeah, I mean, I'm really feeling what Chinmayi said about being in a space like this being so special, because it really is, I think, like led by people of color, led by youth, like these conversations around lived experiences and intersectionality. And it makes me, intersectionality sometimes makes me think of during the last election when a big buzzword phrase was like Latinos are not a monolith. That's something that I don't know if y'all remember hearing that. And as a Latino, I I part of me like appreciated that, and then part of me was like, is that really where we're starting off? Like, what group is a monolith, like, and I think it speaks, like, that whole cultural discourse to me really speaks to how needed ideas like intersectionality are when there is such reductive discourse around people's identities and backgrounds. Yeah, so with that said, I think that is why we really need to strive towards just listening and practicing cultural humility with people who we interact with, and really trying to get to know them as individuals and the various communities that they're a part of, rather than just trying to understand one community and apply that to all people within it. Yeah.
Wow, I'm honestly blown away by all of your insights. Thank you all. You honestly all, once again, have said the things that I would have said. So yes, I really appreciate y'all for being here. And now we're going to go ahead and move on to the exciting part. So we'll be transitioning to some questions that were submitted by our registrants and attendees. And then if we have any extra time at the end, we will invite y'all in the audience to ask any questions. Otherwise, we just encourage you to hold on to your questions and comments for the discussion sections that will be happening right after this panel. So yes, without further ado, we can move into our participant submitted questions. So for the first question, it will be for SJ, and it is, other than being more culturally competent, what are some other ways doctors and mental health professionals can help with immigrant mental health when most of it stems from their trauma and rough upbringing growing up in America?
Yeah, that's a really, really great question. Yeah, I think there is a lot of trauma that that happens while growing up an immigrant in the US. And I would say that, I mean, I really echo what Chinmayi said, that like there is a lot of opportunities to divert resources to more mental health supports. And I would say that a way that anyone working in mental health can help is to, advocate for that, to be politically engaged. Many people here will be community health workers, MDs, PhDs, social workers, all of the above, and all are needed. And I think that, yeah, just, as you keep going through this, really use your platforms and your expertise, because your voices are needed. Our voices are needed. And I would say that it's about mental health resources, and also just advocating for structural changes as well. Yeah, I think that is the way that I kind of navigate that, just trying to remember that, we have voices that we can try and amplify as a group.
Yeah, thank you so much for the answer. I definitely think advocacy is a big part, just because we have these experiences, so we have the firsthand evidence to back up any claims that we make. So yeah, definitely, I think that's a very big part. Which yeah, but I do acknowledge that it is a little hard, because like if you grew up in a community where it wasn't really accepted, it's kind of feeling like you have to break through that kind of barrier. But yeah, I hope this is inspiring others to realize that it's okay, and that it is important, if you really are passionate about it, to advocate for these issues, because I mean, yeah, you've experienced it, and you hope that the other people in the future will not have to face the same level of difficulties, hopefully. But yes, thank you so much. And then our next question will be for Chinmayi, and it is, how can we cultivate emotional resilience and tolerance while respecting people's comfort zones? How do we support individuals in a balanced way that doesn't reinforce avoidance, but encourages developing coping skills and resilience?
This is a big question. I think we would need a whole nother webinar to talk about. But I'll draw a little theme from what SJ said. I was thinking about how I've seen and heard so many therapy cases where, when people have expressed difficulties with, pushing their boundaries, rubbing against their family members' boundaries, and feeling trapped and wanting to escape that. And the therapist said, why don't you just move out? First of all, real estate in this day and age, y'all know how expensive it is. There is that to put off first. Second of all, I think we really need to think about what are cultural limitations in terms of comfort zones. Perhaps in your community, you aren't really allowed to move out of your family's home until you are married, you've set up your own household, moving away for a job, things like that, right? So it's like, how do we kind of meet in the middle in terms of those frameworks? And instead of avoiding the question and just being like, move out, that's a very easy solution. How can we help people who are somewhat need to stay in that sort of a framework until they can get out of it? How do we support them during that transition? So I think rather than kind of choosing those easy and all be all kind of like, yeah, check mark, get out of there, whether that's physical or symbolically, I think just kind of finding those ways of how can we make things work within the existing framework rather than suggesting entirely a new one. Of course, very context, very individual. I can't make that as a blanket statement, but I think that's just one case of how we can be more mindful, I think, when working with individuals in terms of that's an assumption we're making, right? That they can do a certain action. So being careful about that in terms of thinking about not just avoiding, choosing an easy solution.
Honestly, yeah, I definitely really resonate with that because I think it's important to consider, like, when you're giving some kind of advice or like a technique to use, like you have to consider whether they have the ability to actually participate in whatever that change is. Yeah, because I think, yeah, I'll leave it at that. And then the next question is for Wathma, and it is, how can I make my mental health better while being in my 20s? I'm trying to achieve my goals, undergo self-development, make good friendships, be a good daughter to my mother, practice sports, do a lot of stuff at the same time. I'm stressed, and most of the time it's so overwhelming.
Well, that sounds like something I went through in my 20s. Because before I'm a student, I'm a daughter, I am a friend, I have so many duties, responsibilities. So I totally understand this question or this person or this individual who gave it in. That brings back so much memories because I still have it. I'm still going through it. But I will answer it from a therapeutic lens because I'm still a therapist. So self-care. You don't have to carry the whole world on your shoulders. Self-care, practice self-care. What is self-care? For Chinmayi, self-care might be watching TV or reading a neuroscience book. I don't know. What do you like to do? For me, self-care is true crime documentaries, yes. For SJ, listen to music maybe, or something that makes you happy. Try to fit in at least 10 minutes a day of self-care. Time management, having a schedule in place. I learned in my 20s that I can't keep everything up here. I need to write things down. I need to have a set schedule because although I'm like, oh, it's fine, I'm just going to do it in an hour, it never gets done in an hour. Please go ahead and make a time schedule. It's fun. Color code it. It's fun. And having a support system, building a support system. Use those friends that you have. Hang out with your friends. Reach out to people. Talk to people. And ask for help where you need help. I know that's not very easy, especially for some South Asians, because help is something that kind of like affects our pride because we grew up thinking, oh, no, I can do it by myself. I am an independent person. My mom never taught me how to ask for help. Asking for help is bad. It shows that I'm weak. No, ask for help. It doesn't show that you're weak. It just says that, hey, I'm struggling right here. I need a little bit help. And the most important thing that I think that took me a long time and that I'm still practicing at the moment is give yourself a little bit grace. Be kind to yourself. Why are you so tough on yourself? Why are you having so much expectations from yourself? You're just human at the end of the day. Take a step back, take a deep breath, and be kind to yourself. It'll be okay, because I'm still going. We're all still going. It'll be okay at the end of the day. Just reach out for help. Reach out for help. Just don't be afraid. There are people going through the same experiences as you. Reach out for help.
Yes, thank you so much for that. Honestly, I can relate very heavily to the being taught never to ask for help, which is kind of something that I've been working on still to this day. But yeah, it's definitely hard. Um, but yes, thank you for sharing that. And then um, there's one more question I believe that we have time for, but it was directed towards me, so I'm gonna read it. It is, how do you navigate and address the unique mental health challenges faced by immigrant origin youth, particularly when cultural stigma and systemic barriers often hinder access to care? Um, so yeah, definitely I have some experiences with dealing with this. I think both in overall healthcare settings and receiving care, but also in mental health care. Funny enough, my parents are both nurses, but they don't really see healthcare as like, they kind of view it as kind of something that's shameful, something that's a little embarrassing, like, oh, like you shouldn't have to take medications, like you just need to like I basically like rarely go to the doctor for checkups. Like I barely, like growing up, that was what I lived. But it wasn't until recently when I was like, maybe I should go, both for my own physical health and also my mental health side. So that's kind of something that like I had to just, I kind of had to work up a lot of courage to do that because it was like a little hard. But I started reaching out to people to see what their advice would be, or like trying to navigate how to find like the right, like how to find a good primary care physician on my own, or like a new psychiatrist and such like that. So I think um um yeah, I think in general, like it's sorry, I got distracted by the thing in the chat. But overall, like I think it is very difficult, but I think really educating myself and really trying to like learn more about the resources available has been really nice. And like finding communities like Nunchi, like it's really empowered me a lot more, and getting to share the space and like finding people who like made me feel like my issues and like the things that I was dealing with weren't just something that I was dealing with. Like we all, even if we might be complete strangers or like located like all around the US, we're still similar in some ways, and we still all go through these mental health struggles and such. So I think, yeah, definitely my experiences have really shaped that, and it's been hard, but yeah, that's why I'm here today though, and that's why we're all here, I'm sure. But yes, so honestly, that brings us to the end of our panel. Thank you all to thank you so much to all of our panelists for sharing such amazing insights. It was really a